Alam niyo ba kung para saan 'to? 'Di ba nabanggit rin natin, hypertension is one of the most common non-communicable diseases. Yes, that's correct. So, ang ating nifedipine, it's for, um, hypertension. So, anti-hypertensive drug siya, yan. Don't forget, you can use Caripon or Coinrap. Depends on your liking or kung saan kayo comfortable. Yan. Next naman is yung RA 8423, Traditional and Alternative Healthcare Practices. Ito, medyo marami siya, 10. But, I'll still help ko rin kayo na ma-remember siya. Madali lang naman siya. Ang ating mnemonics dito, ang ginagamit ko is Santa Labi. So, sa iba kasi ginagamit rin nila yung baby plants. Pero sa akin, Santa Labi. But you can also use yung baby plant. Santa Labi. Ay. Santa Labi. Yan, isa-isahin natin. 'Pag sinabing sambong, sambong is for diuretic. So, yun lang, sambong, diuretic. Don't forget that. Yes, correct. Diuretic. I apologize for my handwriting. Yan. Worry guys, send ko naman tong notes ko sa inyo. Yan. Pag sinabing sambong, diuretic for kidney problem. Yan. Pag sinabi namang Acapulco, letter A for antifungal. How about the others? Nakikita nyo ba yung sulat ko? Yes. Okay po. So, for Acapulco, this is for A, antifungal. Yan, antifungal. Yan. Pag nyug-nyuga naman, this is for anti-helminth. Helminth. Yan. Wow, alam ng lahat. So, you have a higher chance talaga to pass the board exam. Galing. Anti-helminth. Yan, sa bulate. And remember, nurses, itong nyug-nyuga natin, bawal sa below 4 years old. So, kapag 3 years old to, bawal mong ibigay ang anti-helminth natin or ang ating nyug-nyugan. Yan, 4 years old. Pag tsaang gubat naman, tsaa, this is for diarrhea. And diarrhea. Tsaa. Tsaan. So, tsaa, diarrhea. And pag, yan. Nakakasunod pa po ba? Yan. Yes, yan. Tsaa, this is for diarrhea. Then pag sinabi namang ampalaya, this is for diabetes, 'di ba? Diabetes. Mali na yung spelling. Diabetes and of course, the blood sugar. Yan. Pag sinabing lagundi, remember niyo lang ang ating mnemonics na ASCOF. Yan. A-S-C-O-F. Yan. ASCOF, A for asthma, and then CO for cough, and then also fever. Yan. ASCOF. So, don't forget guys, kapag corner says, pag lagundi, mnemonic natin dyan is ASCOF. Asthma, cough, and fever. Then, pag ulasimang bato, letter U, uric acid. U, ulasimang bato for uric acid. Then pag bawang naman, this is for hypertension. Yan, hypertension or sa ating blood pressure. Yan. Then pag bayabas, this is disinfectant or panghugas ng ating sugat. Yan, antibacterial, antiseptic. Yan, antiseptic. Antiseptic. Then pag sinabing yerba buena, this is for yerba buena. Sige nga. What's the use for yerba buena? Yan. That's correct. So, yerba buena is for pain. So, analgesic siya for pain. Remember, nurses, itong yerba buena natin, it can be applied topical. So, pwede lang ilagay siya directly kung saan masakit since it's topical. Itong yerba buena. Topical. Yan. Yan. So, we have 10 traditional and alternative healthcare practice, yung mga halamang gamot natin. So, as much as possible, i-familiarize natin again yung sarili natin dito kasi so that kapag tinanong siya sa isang situation, we could answer it correctly. Ayan. So, remember nurses also, the process naman ng preparation nito is through decoction. Ayan. Delete ko na to ha. Just gonna erase it. Don't worry, sasend ko po sa inyo itong PPT. Ayan. Nalan. So, ang preparation niya is decoction. So, ano bang ibig sabihin ng decoction? Ito ay the process of boiling. Ayan. I'm gonna type it na lang, decoction or boiling. Boiling. So, ginagawa dito is you chop 1 cup of leaves and then you would boil it in 2 cups of water. Ayan. Decoction kasi, 'di ba, it is boiling. So, you would chop 1 cup of leaves and then boil in 2 cups of water. Ayan. Una is, 'di ba, madi-discard mo yung leaf and then remember dapat you would boil it in clay pot for 15 to 30 minutes clay pot. Kasi tinanong also yan kung saan daw biniboil ang ating halamang gamot. Ayan. So again, binaboil siya sa clay pot within 15 to 30 minutes. 15 to 30 minutes. Yan. So, sige nga, kindly comment again in the chat box. Sige. Magbabanggit ako, then you will tell me kung saan dito sa 10. Hindi po, 'di ba, after you chop the leaves, tapos ibo-boil mo po siya in 2 cups of water, magiging ready siya, dapat mag-iiwan ka at least 1 cup of water. And kasi kapag naubos, you have to watch it talaga. Magtitira ka ng 1 cup of water. Ayan. Okay. Anong halamang gamot that would treat ang ating ASCOF? The asthma, cough, fever. Tingnan, kindly comment. Yan, bibilis. Yan, lagundi, correct. How about yung diuretic natin for kidney problem? Yan, diuretic. Yes, sambong. Ulasimang how about ulasimang bato? What does it treat? Yan. Letter U. So, ano yun? Ulasimang bato, letter U. Correct. Uric acid. So, last question. Ano ang halamang gamot that is applied through topical? Isa lang to. Siya lang natatanging halamang gamot that is applied through topical. Yung tinatapa lang mismo sa kung saang part ng body yung masakit. Correct. Ayan. Yerba buena. You remember, nurses, that Yerba buena is for pain and it's applied topical. So, siya lang yung topical. Yan. Next is, we have the nutrition program naman. Ito naman yung para, kanina 'di ba we discussed yung mga microsupplementation. So, ito naman, we have the common nutritional deficiencies. So, una, we have vitamin A, iron, and iodine. So, sa mga food natin, we have to see, mahalaga talaga na may ganito. So, this is araw ng sangkap. Kapag may ganito kasi, it means that it is filled with vitamin A, iron, and iodine. So, pag tinignan natin sa ibang food yan, makikita natin itong logo na ito. So, again, ano nga yung best indicator of nutritional status? Yan. Best indicator po ng ating nutritional status? Yes, that is correct. So, we have BMI. Ayan. So, for our food fortification po, 'di ba, the vitamin A distribution through araw ng sangkap Pinoy or garantisadong pangbata. So, first is we have, this actually, food fortification act, this is mandatory. So, ang flour natin, it's filled with iron and vitamin A. Yan. Then, cooking oil and refined sugar is also rich with vitamin A. And then, ang rice natin is filled with iron. Again, mahalaga po ito kasi 'di ba, ang common deficiencies natin is vitamin A, iron, and iodine. So mahalaga na we have this logo talaga to see that it's filled with this supplement. Yan. Okay. Now let's go sa food sanitation or sa sanitation PD 856. Yan, ang ating sanitation code is PD 856. So first we have the right source. So sa tingin niyo saan natin nakukuha ang fresh source of food? Sige nga, where do you guys think na puwede nating makuha yung mga fresh source of food? 'Di ba, we can get our, fresh source of food, yes, could be sa mga wet market. 'Yan, 'di ba sa palengke mga fresh yung isda dun. 'Di mo sure sa iba. Pero yes, puwede nating makuha yung fresh source of food sa wet market. And then for preparation naman, you have to check siyempre the expiration date. So, wag lang bili ng bili, luto ng luto, we have to check the expiration date. Then right cooking. So, 'pag sinabing right cooking, dapat ang temperature kasi natin diyan is above 70 degrees. Yan, 70 degrees Celsius. Yan, 70 degree. Ta-type ko siya. 70 degrees Celsius, above 70 degrees Celsius. Kasi yung microorganisms is puwede pa siyang mabuhay sa 10 to 60 Celsius. So, kailangan mas mataas dun, dapat 70 above. Then 'pag right storage, ibig sabihin nito, yung food dapat, yung pagkain natin 'pag nilagay sa table, 'di ba, room temperature, it is only safe for 2 hours. 'Di ba? Yung mga food are only safe in room temperature for 2 hours. Kasi sa'tin, however kasi naman sa'tin 'di ba, when naglalagay tayo ng food sa table ng gabi and then still sa umaga kinakain pa rin natin. However, yung food nga again, only safe siya sa room temperature for 2 hours. So kapag more than 2 hours na yung food nandoon, it's considered contaminated na. So dapat tapon na natin yun. And again, sa room temperature lang 'to, pero kung nasa loob naman siya ng refrigerator, puwede pa siya. Yan, 'di ba ang rule natin as nurses, when in doubt, throw it out. Yan. Yan. So, now let's go naman sa hospital waste management. So, ito naman tinanong din siya nung last November. So, tinanong siya, ano daw ang ano daw ang kulay na hindi kasali sa hospital waste management. So, meron dong red, blue, orange, then pink. So, ang sagot doon is pink kasi wala namang pink doon. So, okay. Let's start muna sa red. Yes, pink yon. Pink ang hindi kasali. Yan. So, kailangan memorize mo talaga to kasi if not, di ba, it could be little tricky for you kapag hindi mo alam yung mga color dapat. So, una is red. So, pag sinabing red, dito ay sharps. Yan, red sharps. So, ano ba yung mga sharps natin? Siyempre, yung mga used needles, or yung blood, or yung lancet, di ba? Pag kinuhaan ng dugo, check yung blood sugar, ayan, yun yung mga lancet. Then, scalpel blade. Basta lahat ng matatalas, tinatapon siya sa red. Yan, di ba meron rin yang nakasakit, tapos parang um, maliit lang siya na opening para doon mo ipasok yung mga sharps natin. Then, pag sinabing blue, it is recyclable. Yan, recyclable. Recyclable. Yan. Pag recyclable, ito yung mga empty medicine vials or yung mga plastic packaging sa mga medical supplies, ayun, pwede siyang i-recycle. And color blue siya kapag recyclable. Pag sinabing orange, ito yung mga biohazard. Biohazard. Ano yung mga biohazard? Yung mga use na surgical gloves or gowns, yan. Mga contaminated na materials from the isolation room, yun yung mga biohazards. For example, yung mga blood-soaked items rin, ganun. Then pag sinabing black naman, this is dry, non-infectious. Dry, non-infectious. Dry, non-infectious. Dry, non-infectious. Pwedeng ito yung mga basta ito, non-contaminated item. So, pwede yung mga papel, mga empty medication packs, ganon. Then, pag sinabi namang green, this is wet, non-infectious. Wet, not infectious. Non-infectious. Yan. Yan. So, kapag wet, non-infectious, in mga wet towels or linen. Then lastly, we have yellow. Ito yung mga infectious naman. For example, yung mga used bandages, yung mga dressings, yan, mga cultures and specimen na ginamit sa laboratory. Yung mga materials yan na mga contaminated with blood or body fluids. Yan. Tama. Sige. Sige, I'll tell an example and then you will tell me again kapag red kung anong kulay siya. So, yan. Burahin natin. So, call, um, anong kulay kapag tatapon natin ang mga sharps natin or mga used needles? Yung mga lancets. Yan. Correct. How about yung biohazard? Like yung mga used surgical gloves and gowns natin. Biohazard siya. Contaminated materials. Correct. Yan. How about infectious? Ito yung mga ginamit na bandage and dressing sa ating patient. Yan. Yellow. That is correct. How about yung mga wet towels or linens natin? Wet, non-infectious. Basta in non-infectious. Green. Okay. How about dry, non-infectious? Dry. Yan. And lastly, ang ating mga recyclable, diba? We have plastic packaging, yung sa medical supplies. Yan, blue. Yan, nag-gets ng lahat. Hmm. Thank you for participating. Gagaling. Okay, last for our discussion is yung National Blood Services Act naman. We have RA 1179. Yan. So, in this blood donation, 'di ba, we have different criteria here also. Yan, discuss natin siya isa-isa. Yan. So, remember, nurses, that this blood donation is done every 3 months. Yan, so after 3 months, yan, every 3 months. So, blood donation can be done every 3 months. Yan. Blood donation can be done every 3 months. Yan. So, RA 7719 po tayo for National Blood Services. RA 7719. Yan. Then, we have different criteria po dito. Una is 16 to, yan. Okay, I'll just type it na lang. So, we have different criteria kasi. Yan, criteria. So, una is we have 16 to 65 years old. So, kapag 17 ka, pwede ka magbigay ng dugo. Basta between 16 to 65 years old. 65 years old. Also, 45 kilogram and 50 kilograms. Kapag 45 kilogram or 45 kilos ka, you would donate blood at least 250 ml. Then kapag 50 kilos above naman, kukuning dugo sa'yo is 450 ml. So itong 16 to 65 years old, it could be male or female, basta between age of 16 to 65 years old. Next is 45 kilogram and above 50 kilogram, pwede. So kung ang weight mo is 43, hindi ka pwede mag-donate ng dugo. And pag 45 kilos ka, 250 ml ang kukunin sa yung dugo. Then pag 50 kilos above, then 450 ml. Also, dapat ang hemoglobin levels mo ay 12.5, which is the normal level. And also ang ating BP. Then for BP naman, the systolic, yung SBP natin or yung systolic blood pressure natin is between 90 to 160. And ang diastolic blood pressure naman is 60 to 100. Ayan. Again, ang criteria natin, we have 4. Yan. Una is 16 to 65 years old. Yan, tinype ko na rin siya sa chat box. Then, 45 kilogram and 50 kilogram. So, should be above 50 rin. Pwede. And kapag below 45 ka, hindi ka pwede mag-donate ng dugo. Then, yung hemoglobin mo is 12.5 and hemoglobin. And then, ang ating BP, di ba? We have systolic blood pressure yung nasa taas between 90 to 160. Then, diastolic blood pressure is 60 to 100. Ayan. And again, national blood donation is done every 3 months. So that ends our session for Community Health Nursing 1. Okay, I'll try to open my cam. Yan. Hello, good evening po sa lahat. So I hope may natutunan po kayo during our session. So, my message lang is, it might be hard for you na matandaan lahat ng diniscuss natin, but don't forget that as you go on, during the review days, maalala nyo rin to. Don't worry, nandito naman kaming mga lecturers nyo that would guide you. Yan. I can assure you naman that this community health nursing would be your saving grace once you um, answer na during